Welcome back to our channel. Today, we're diving into a topic that many of us have encountered at some point in our lives: strep throat. Viruses cause most sore throats. However, strep throat is an infection in the throat and tonsils caused by bacteria called Group A Streptococcus. How you get strep throat? Group A strep bacteria are very contagious. Generally, people spread the bacteria to others through respiratory droplets, direct contact. Rarely, Group A strep bacteria can be spread through food. It usually takes 2 to 5 days after exposure to become ill with strep throat. Group A strep bacteria often live in the nose and throat. People who are infected spread the bacteria by talking, coughing, or sneezing. This creates respiratory droplets that contain the bacteria. In general, strep throat is a mild disease, but it can be very painful. Common symptoms may include fever, pain when swallowing, sore throat that started very quickly and may look red and swollen tonsils, tiny red spots on the roof of the mouth, called pesky, swollen lymph nodes in the front of the neck. Symptoms do not include cough or runny nose. Some people are at increased risk. Age: strep throat is more common in children than adults. It is most common in children 5 through 15 years old. It is very rare in children younger than 3 years old. Close contact: contact with children, parents of school-age children and adults who are often in contact with children are at increased risk. Crowded settings can increase the risk. These settings include daycare centers and schools, detention or correctional facilities, homeless shelters, military training facilities. A healthcare provider will determine what type of illness you have by asking about symptoms and doing a physical exam. If they think you might have strep throat, they will swab your throat to test for strep throat. There are 2 types of tests for strep throat: a rapid strep test and throat culture. Who are strep carriers? A carrier is someone who tests positive but has no symptoms. Generally, carriers don't need antibiotics. They're less likely to spread the bacteria to others and very unlikely to get complications. What to do if you are tested negative? For children and teens, culture is important. For adults, it is not necessary to do a throat culture. Antibiotics aren't needed if all the test results are negative. Antibiotics are used for treatment. Antibiotics decrease how long someone is sick, decrease symptoms, prevent the bacteria from spreading to others, prevent serious complications like rheumatic fever. Serious complications are not common, but they can get abscesses around the tonsils or in the neck, sinus infections, ear infections, rheumatic fever, post-streptococcal glomerulonephritis. Protect yourself and others. Cover your mouth and nose with a tissue when you cough or sneeze. Put your used tissue in the wastebasket. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand rub if soap and water are not available. Wash glasses, utensils, and plates after someone who is sick uses them. These items are safe for others to use once washed. Well, that wraps up our discussion on strep throat. Remember, if you think you or someone you know might have strep throat, don't hesitate to seek medical advice. And as always, if you found this video helpful, be sure to give it a thumbs up and subscribe to our channel for more informative content. Thanks for watching, and take care.